everything has a different twist when all of a sudden it's you in that hospital bed, when it's you that's calling 911 and concerned about what the reaction will be, and will they be able to help me here? Am I going to be flown to Seattle? What's happening?
You know, the Heart Center is probably, again, another best kept secret in our community. However, when the foundation works with the Heart Center, we identify items that are important for the community. Our donations from particularly this luncheon go directly to the Heart Center, and the impact's been big. We've replaced significant equipment. Another really important program we helped with was what they called the heart monitor. It's called a Zio patch. If you think about that, now you've got thousands of patients that understand that they have access to this. They don't have to go to Seattle.
You know, the goal at the Heart Center and most of our services is, you know, try to take care of people here at home, closer to where they live, hopefully for better outcomes. So all the funding that can come in from outside of our operations always helps us. And I think having focus on the Heart Center has really helped it grow a lot and bring more services here locally. A lot of people have a Heart Center story to share of their own, and they do a lot of great work.
I attended Red, Set, Go, and it was always fun, and I'd listen to all of the good advice about health and taking care of yourself, especially for women. About 2 years ago, I was at a reunion party with some friends, and my heart started fluttering. And so that brought me that evening right to the hospital. And so I really began to see what our hospital provided in terms of diagnostic and rehab. It was life-changing. I didn't have to go to Seattle. I could do it in Port Angeles. I was comfortable and had all those needs met.
The quality of care at Olympic Medical Center for heart disease is actually quite high. We don't do the full spectrum of everything. We don't do angiograms, etc. But over the years, we've built a really great program. We have a lot of support both from the hospital commissioners as well as from the foundation to have state-of-the-art equipment. It used to be that the limiting factor for providing care in the community were physicians. Now I think since the pandemic, one of our main limiting factors in growing our programs and keeping our programs up and running are the technical employees as well as our nursing staff.
And so it's really important that we have the diagnostic and someone to read those results. And so we're continuing to support the nursing program at Peninsula College. I'll go right there because we need nurses.
Take a quick listen to your heart and lungs.
I feel really lightheaded. It's getting worse.
It's getting worse. So I'm going to call the code. Erin, can I get you in here to help me with hands? Can you go into the clean utility room and grab me the protocol bin and everything?
So I received a scholarship through the OMC Foundation this year, and that has made a huge difference in my schooling and life. I mean, if I had to travel to Bremerton or somewhere else, it probably would never have happened.
The foundation listened to the hospital, so we're able to identify key positions within the hospital that would be helpful with the scholarship program.
They've reimbursed us for our housing and help with just utilities and my childcare expenses. 'Cause a lot of times I have to stay after they're out of school for my classes.
OMC can recruit you right when you're in school. So there's no leaving the community. You have access to employment right here.
I'm here because my family is here on the peninsula and I grew up here. I have no intentions of ever moving. Being able to get this nursing degree and open up all those other job opportunities, it really, really makes a difference.
We got to take care of ourselves. We can't expect someone else to recruit here. And so workforce development is paramount.
It fills me with a warmth of understanding to know and to watch the community with the buy-in into their medical center. And for us to share in that process is priceless.
The foundation has made a tremendous financial impact to the hospital, but remember this, none of that happens without the generous donors. So it just shows you the commitment of the community.
The biggest pleasure I get out of working with OMC, their cardiac center, is the opportunity to kind of take care of our extended neighborhood. It's not just relationship forming, but we get essential services. There's better access to imaging, there's better access to rehab, there's better access to whatever resources that might be deemed necessary that are outside the scope of any more global budget for the healthcare system. These issues are addressed directly by a foundation.
The funds that our community provides, it's real. It's purchasing the most modern technology, and then to back that up, we need the people that can also use that technology. So it was a whole different view as a patient to see and be able to appreciate what we could offer here at home, what a difference the events make of the foundation, that this is real.